Well, hello, everyone, and welcome to our Keeping the Promise conversation series with candidates for California's next governor. Between the candidates and the disability community in California, my name is Jordan Lindsay. I'm executive director of the ARC and United Cerebral Palsy California collaboration. I'm also co-chair of the Lanterman Coalition, which is the coalition bringing you this webinar series. This is the second conversation in our Keeping California's Promise candidate interview series. The Lanterman Coalition is a statewide alliance of more than 50 disability organizations working together to protect the civil rights of Californians with intellectual and developmental disabilities, their families, and the workforce that supports them. That's more than 500,000 individuals with intellectual and developmental disabilities, family members, those that support them. We're talking easily around 1.5 million Californians across the state that the Lanterman Coalition interacts with and very proud to support and advocate for. For decades, we've advocated to uphold the promise of the Lanterman Act, which is a landmark civil rights law that guarantees access to services and support so people with disabilities can live full lives in their communities. Keeping California's Promise this is a nonpartisan educational series designed to help voters better understand where candidates for governor stand on issues like disability rights, services and supports, California's long-term commitment to our community. So each candidate is going to be asked the same questions with a focus on leadership, accountability, and real life impact of the policy decisions they would make as governor. And all candidates for governor have been invited, just so you know, to be part of this interview series. And scheduling is ongoing. So you can check the website at lantermancoalition.org to stay updated. So now I'm pleased to welcome today's hosts who will lead our conversation. Barry Giardini is the executive director of the California Disability Services Association and a co-chair of the Lanterman Coalition. And he will be joined by Azucena Garcia, who is a disability rights advocate, also a host of her own podcast. And Barry and Azucena, thank you for being here. Please join me on screen and introduce yourselves and today's special guest. I'll turn it over to you.
Thank you so much, Jordan, and good afternoon, everyone. Welcome to today's interview. As Jordan mentioned, I'm Barry Giardini, Executive Director at CDSA. We represent service providers throughout the state of California who serve individuals with intellectual and developmental disabilities, and it is my great privilege and honor to be with you today. And I want to thank you, Azucena, for being part of this interview series with me.
Thank you, Barry. It's truly an honor for me to be here today. And I think before we hear from Javier, as he allowed us to call him, Xavier Becerra, thank you so much. I want to introduce myself to everyone who's part of this series and also to Javier. I am a proud daughter of Mexican immigrants. I am a first generation college graduate from UCSD, where I was born and raised in San Diego, so I'm a proud Triton. My journey, my life has been shaped not only by my family's resilience and sacrifice, but by my own experience living with a disability. I was diagnosed with cerebral palsy at the age of 2, and as a result of my CP, I've undergone 18 orthopedic surgeries, which have given me firsthand insight on the healthcare system and the systems in place which are meant to support people like me, people with disabilities in the state of California. So it's truly an honor for me to bring my community's perspective into this conversation, but also my lived experience. Thank you, all of you, for joining us today. It's truly an honor.
Thank you so much, Azucena. It's truly an honor to be co-hosting this with you today. And as you mentioned, today we are pleased to welcome Xavier Becerra, a candidate for governor of California and a longtime public servant with decades of leadership at the state and federal levels. Javier has more than 35 years in public service. including roles in the California State Assembly, the U.S. Congress, as California's Attorney General, and most recently as the 25th U.S. Secretary of Health and Human Services in the Biden administration. He has worked on issues that directly impact Californians with disabilities. And as Secretary of Health and Human Services, he oversaw Medicaid, Medicare, and federal disability and aging programs, helping to protect the Affordable Care Act, expanding access to health care, and lowering prescription drug costs. Xavier was raised by parents who worked hard for their family's future and says he's running for governor because California faces urgent challenges from affordability and healthcare access to economic opportunity. And he believes his experience delivering results can help move our state forward. Secretary Becerra joins us today to share his priorities for Californians with disabilities and how he plans to protect and strengthen the promise of the Lanterman Act as part of this Keeping California's Promise series. So please join me in welcoming warmly Secretary Xavier Becerra.
Barry, Azucena, thank you very much. And I want to thank each and every member of the Lanterman Coalition who is joining for the opportunity to be with you, and to thank each and every one of you, sort of to the point that Azucena made, for your effort on behalf of people with some form of disability or families that need some assistance. This is very personal to me. As a young boy, my parents used me, sometimes my sisters, to help them translate and understand better what was going on around them. And it puts a lot of responsibility on you, especially when it deals with medical or health services. And you realize later on in life what kind of mistakes you could have made as a child. But that's where some families are. And that's why the Lanterman Act is so important, because the Lanterman Act doesn't just say we should do something, it says we must do something. It is an entitlement. And so no government agency has the right to shirk its responsibility to make sure families are receiving the care they need. So this is very personal to me. I should continue to say it's very personal because the very first job I had as an attorney, straight out of Stanford Law School, and so most of my colleagues were going to work for big firms for big pay. I started making $18,000 working for legal services. My job was to represent Americans with disabilities, whether it was mental health challenges, whether it was developmental or intellectual disabilities. There were a lot of people who were not receiving their services, who were being misdiagnosed, and they didn't have the money to challenge the incorrect service provision. And so it was my job as a legal services attorney to try to represent their needs. From there, I went on to work very hard, and you can take a look at my record in Congress over the years, over 24 years, defending disability rights, defending communities who were entitled to services. As the Attorney General, I was the AG in California who established the Disability Rights Bureau in the California Department of Justice, because I wanted to have a specific team of attorneys who could focus on cases that are important to Americans, Californians with disabilities. I also, as you may know, defended Section 1557 of the Affordable Care Act, the provision that prohibits discrimination on the basis of race, color, national origin. We all know those, sex, but disability as well. And I defended that against the Trump administration's attacks on the ACA and the ability to provide services to all, especially women's health care, reproductive rights, and to Americans with disabilities, because oftentimes we find that insurance is lacking when it comes to providing access to health care. I went on as Secretary of HHS, and I did the biggest reform of Section 504 of the act that protects Americans from disability discrimination. It had been several decades, I think about 5 decades, since the last real major change to Section 504. And what we did was made it clear that any type of discrimination, even if it's one that you think you're doing it for the benefit of the person who's disabled, could be considered actionable, and that Americans with disabilities have the right to take action to protect themselves. I did that. I also can tell you more about the work I did to actually make sure that those who take care of folks with disabilities, the workers who do the in-home support services, actually got paid better. I passed a rule, and I'll close with this, that said that any Medicaid dollar that goes to provide in-home support services, 80% of that dollar must be used to pay the person doing the work. It can't be kept by the program that administers the services. It must go to pay the workers, because we found that too much of the money was being skimmed off. And if those folks don't stay in the job because they can't afford to, they get paid too little, then you who need the care will never have a stable source of reliable, trained and experienced care to help you with your needs. And so we passed that rule for the first time in the history of the Department of Health and Human Services. This is very personal to me. I'm thrilled that you've invited me, and I'd love to chat more about what I would do as governor. Thank you.
Thank you so much, Javier. You got a little bit ahead of the game, and I appreciate that. That was actually going to be the first question. You know, what is, which you shared. What I thought was very interesting is that you mentioned that right off Stanford you went on to work, right off Stanford Law you went on to support and fight for people with disabilities when everyone else was not doing that. So actually, since I had the exact same question, what further personal experience do you have with people and families that have children or siblings with developmental disabilities? Is there anything else you would like to add, like family member or of any case, anything?
Yeah. You know, and as Rosanna, this may sound familiar to you, but when I was growing up, especially if it was not a physical disability or a trait that was physically obvious, oftentimes, most of the time, because families didn't have a lot of money, we'd essentially say, don't worry, give it time, it'll go away, or things will improve. Or in some cases, especially if you were a young man or a boy, you know, suck it up. You can handle this. And oftentimes it's because people lack the resources to get you the care you need. Oftentimes it's because people didn't have the understanding and the fundamental experience to know what might be going on with their family member, their child, or otherwise, who may need some support, for example, with developmental disabilities. And the result is that care often gets to them very late. When I became that attorney and working for legal services, that really did inform the work that I did, because I knew that oftentimes I was working with families who didn't realize that they could fight for more and they had some rights for their family members. And that's what informed so much of what I did. So when I became the Attorney General, it shouldn't surprise you that I established the Disability Rights Bureau, because I understood what it meant to have people go without. And I understand what it means that even though I had one of the largest legal teams in the country, unless we focused on this work, it wouldn't happen until we were reacting to somebody saying, my rights were violated. So rather than wait, I established this bureau so we could go out and affirmatively find those cases so we could exact justice much quicker for folks. And then, of course, as Secretary of HHS, with the Medicaid program, with SAMHSA, the agency that deals with mental health and other disabilities directly, we started to act quickly. And that's why we were able to move to get reform of Section 504, because it's become clear that too often we treat an individual with a intellectual or mental disability or developmental disability as second tier, second class, from someone who manifests a particular ailment or condition. And insurance companies, of course, do that even worse. So I wanted to take that affirmative approach of not waiting. I wanted to be able to aggressively pursue this. And that's why we took these actions. I also should say that under Section 1557 of the ACA, we took numerous actions to defend Americans with disabilities against discriminatory treatment by principally insurers, but also by some providers as well.
Actually, for the next question, I thank you so much. I'll hand it over to Barry.
Yeah, thanks, Susanna. And Secretary Becerra, that a really comprehensive answer on that last one that really preempts my question again. It's almost like you're reading our script. But I mean, obviously, you have a ton of depth and breadth in the disability rights fight. People with intellectual and developmental disabilities today, nevertheless, despite your efforts in your various roles, continue to face an ongoing fight for civil and human rights and justice. The question was going to be, how have you shown your commitment to fighting for those civil rights? And I think you've pretty well established that here. So maybe if I can tweak this a little bit, or you can expand on that initial question, would be, people with disabilities, want to be part of their community every day. I mean, maybe can you speak to some of the impact on some of the legal work and some of the work you've done in your various roles to really ensuring people with disabilities are included in their communities, are able to live full and inclusive lives in California, and maybe kind of blend those two things together, if you will?
And Barry, you used the operative word for me, inclusive. I learned really early on that we exclude too many Americans, sometimes intentionally, sometimes by omission. Nonetheless, people get excluded. When I was a kid, again, my family didn't have much, and so we rarely got to take advantage of or partake in services that most families who had some resources could. We would visit the doctor periodically, but it wasn't an often thing. Dentist periodically, but very little, even less optometrists and so forth. So you begin to realize that you're not always allowed through the door. In fact, my dad used to make it very poignant when he would say, Javier, you should see what it was like when I was a young man. He said that when I was a young man, there were signs outside establishments like restaurants that read, "No dogs, Negroes, or Mexicans allowed." You knew you were excluded from the beginning. And so what he said is, you just got to work hard and you'll earn your opportunity to go through the door. And so that's the way. It's sort of what I mentioned to Azucena earlier. You almost have to earn your right to get those services, right? Because it's not handed to you. And you just learn, you just got to keep working it. So what I'll tell you is this. For me, especially as governor, inclusiveness. If I have you in the room, if I have you at the table, there's a really strong chance that if the Lanterman Coalition is at the table, we're going to have a housing policy, because all of us are saying we're going to build more homes. We're going to have a housing policy that also includes homes, housing units that will accommodate people who have disabilities. If you're not in through the door, there's a good chance that we'll still build a lot of housing, but it will not accommodate the needs of many, many Californians who would love nothing more than to have a nice place to live and sleep as well, but whose needs won't be met until it's an afterthought. And so inclusion is so important to me. That's why we made changes to Section 504. That's why we defended 1557 and actually instituted actions ourselves. That's why I established the Disability Rights Bureau at the Department of Justice. Instead of wait for us to hear that someone was wronged and be reactive, no, I'm going to include you from the beginning so we can affirmatively address these things. And as governor, what I will tell you is that this coalition, which I've had a chance to work with in the past, ARC and all the different players of this coalition, will have a seat at the table, because you should be included when we make the decisions that are most important to the people of California.
Wonderful. Thank you. And you mentioned housing in particular, and that was where I was going with my next question. So just to build out on that, of course, in California, very high cost of living, affordable housing is a statewide crisis, right? Large unhoused population. People with developmental disabilities, most of whom have very limited incomes, are often underrepresented in talks about those solutions. I'm so gratified and grateful to hear that you want to make sure people with disabilities are brought to the table and included in those conversations. Beyond, including the Lanterman Coalition writ large, what would you do to make sure that people with disabilities' voices and their interests are, front and center in some of that affordable housing development?
Yeah, well, the most important, as I said, is let you through the door, give you a seat at the table. So once you're included, your voice will be heard. And if your voice is heard, there's a strong chance that we're going to adopt policies that incorporate the most important needs of those in the disability community. So, for example, I think it really important to have accessible design in whatever housing plans that we have, that we have housing plans that geographically also take into account the regional centers that support Californians with disabilities, so that we are creating a situation where it's not just a great place to live, but it's also nearby the service centers where you will be making constant visits. Giving a chance for someone who's lived through or has relatives or has been a big advocate in the disabilities community to have a clear voice in the actual planning, especially of these affordable units, will be critical. So this way we're not leaving out any ideas that are there available from people with lived experience. And so I think it's really not rocket science. I tell people that the worst mistakes that people make, and I say this as an attorney for decades and the former Attorney General of California, is we exclude. And when you exclude, sometimes the only way people's voice can be heard is if midstream they say, you didn't give me a chance at the beginning, now I'm going to say my piece, but I'm going to say my piece through a lawsuit. And when they file the lawsuit, guess what? They stick a wrench in the process, and they, in many cases, they bring a whole system to a halt. And that halt is expensive. Time is money. Probably the easiest example I can give you is high-speed rail. Why is it that Europe, Japan, China, so many countries can build high-speed rail, but California, the fourth largest economy in the world, seems to be unable to do so? I think it's because we left too many people out of the building, out of the room when decisions were made, and the only way they felt their voice could be heard was when the plans had already, the roadmap had already been set, and people were going down the road, and they spoke up. And had they not raised some legitimate concerns, the courts wouldn't have given them the time of day, and the projects would have continued. But the projects have been constantly halted, and the halt costs money and time. As my mom trained me as a very young age, when she would say to me, "Mijo, mejor prevenir que remediar." My son, it is always better to prevent than to remediate. I'm simply trying to prevent a situation where my project is gummed up in court and costing me more money. And that means I'm letting everyone into the room to sit at the table and help me figure out where we go. So once you've been at the table, it's a lot harder for you to claim that you have a right to sue me later on down the line. That's the way I operate. That's what I'll do as governor. And absolutely, this coalition and its members will have a seat at the table.
Thank you, Secretary Becerra. Excellent. Passing it back to Azucena for the next couple of questions.
Thank you for that. Thank you for making it clear that we will have a seat at the table. Very important, because many times a lot of families feel like they are not seen, right? And something that I didn't mention in my introduction, and I will mention now as it relates to my next question, is my father died when I was 2 years old, and so that left my mother caring for 2 young children with disabilities, right? And oftentimes families and siblings play the role of primary caregivers of their loved ones with disabilities. What proposals do you have to better support families like mine, mothers like mine, whose work and devotion make it possible for their loved ones, for their children to stay at home? What concrete proposals and steps do you have to better support families in California?
So, Azucena, we really don't have to reinvent the wheel here. In most cases, when it comes to disability services, we have obligations as a government, state, federal, local. It's just that they're not fulfilled. Most of the time, what's going on, well, mental health parity law. Why is it that mental health is treated so differently from physical health? If it's in the law and it says it must be treated on par with physical health, it's because the enforcement has not been there. And so one of the ways you make sure that you implement the laws that are already there are by enforcement, oversight and enforcement. I say that not simply because that's what I think is the solution or part of the solution. It's because I was the attorney general and I had to do so much of the enforcement. And so what I will tell you is that we must not under service or under support the oversight and enforcement capabilities of federal agencies to make sure that services are being provided, which I think is what happens in too many cases. And so therefore, we just simply try to enforce what is existing law. Where I do think we have to supplement is how we incorporate the voices of communities in the first place. It goes back to what I said before, let people in, be inclusive, because too often the design of a plan, a service, did not take into account the needs of the very people it's supposed to serve. And therefore you end up with a design that doesn't meet the needs of the people. Having people with lived experience sitting at the table sure informs what the final product will look like. And so that becomes important too. So oversight enforcement, the inclusivity discussion that we had earlier to make sure that people are at the table early to help design whatever the product or service will be going forward, that it works, and then making sure we fund it. Because oftentimes the excuse is, we ran out of money. No, we fund it. And there's where it's really important to make your budget reflect your values and show that you're prepared to fund it. And so those are perhaps the three most important things I can tell you.
Thank you so much for that. I'm making mental notes as you speak. And one of the things that, and actually you'll see me reading from my phone screen because I have this question and it's so important that I really don't want to miss anything. But before I read it, I am a client of the regional center, and one of the things that we are entitled to is having in-home support services and DSP professionals to, support us. So that goes to my next question, which is, DSP is the workforce itself is a huge lifeline for the IDD community, right? Yep. My mom didn't have a lot of support, so I relied on DSP professionals. I relied on IHSS professionals to come home and help me out. And yet they are currently in dangerously low numbers. What are the best ways through public policy, do you think, to attract and to maintain, to promote, attract, and to maintain the people who are seeking work in this field? Because as you already know, I'm sure, they are competing with the larger labor force. So what would you do to promote and attract and maintain DSP professionals, which are the lifeline of people like myself?
Susana, I will not only tell you what I would do, but what I have done, which I believe I can say with clarity and certainty. I'm the only candidate for governor who can say to you, not just what I would do, but what I have done on these issues. I mentioned one of the things already, because we saw how in so many cases, people who were doing in-home support services, payments through the Medi-Cal program were paid so low, and it was difficult work. It was almost impossible for a lot of these folks to see this as a career, because you in many cases were being paid minimum wage if you were lucky. And you were doing work that oftentimes left you disabled because you're lifting up people who are sometimes heavier than you. You are having to bend over. You're doing things that are difficult work. So much so that oftentimes people would say, I can make more money flipping burgers at the fast food joint than staying and providing support to this individual who is at home. And so that's why we passed the rule, the regulation that said that if the taxpayers are going to give through the Medicaid program, through Medi-Cal, payment for these services, then the bulk of that money should be paid to the person doing the work. That's why 80% of every dollar, of every Medi-Cal dollar, must be dedicated to pay that person doing the work. Not so that the program that hires the person to send to that individual who needs help can skim off money for overhead and all the rest. No, do the work. Second thing I can tell you, I ran into a different program, but a similar circumstance. You're familiar with the Head Start program for children under 5. HHS, the Department of Health and Human Services, runs the Head Start program nationally. Obviously, the states have their individual programs and locally, but Head Start money comes from the federal government. HHS operates it at that level, and we oversee it. The difficulty with Head Start has never been big enough. We've never gotten enough money to let all kids who qualify and all parents who need it use it. But even then, Congress funds it for about $750,000 slots for children to be at Head Start programs. Yet, only about 2/3 get filled. So 750,000 or so slots, Congress says it funds. 670,000 or so are actually used. Why wouldn't Head Start programs add additional slots in their classrooms for kids to come in because there are parents who are pounding on doors wanting to get them in? Because those programs could not find teachers. Why couldn't they find teachers? Because they're so underpaid. You have such turnover in Head Start because these teachers make far less than a K through 12 teacher. And in fact, they make less than that person flipping burgers. And so what I said, okay, why don't we take those phantom slots that are never used, some 80,000 slots, and let's put them into actually boosting the salary of teachers. So our proposal boosted salaries by $10,000 for Head Start teachers. We were able to get that through. Unfortunately, this new administration looks like it's going to not let it move forward. But what we figured is the first thing we had to do was make it worth someone's while to actually make Head Start teaching a career. If you can't make it a career, you're going to have constant turnover. If you have constant turnover, you're never going to have enough people doing the work. If you don't have enough people doing the work, the people who need it are never going to get the services they need from skilled individuals. Now, I translate that over to the situation we find ourselves in for the IDD community. Same thing. It is so tough to find someone you can keep because they're constantly struggling themselves. We need to respect those professionals because that's what they are. They're professionals. We have to pay them a wage that makes them feel like they are professionals and they can make this a career. We have to solidify the underpinnings of the workforce so we can attract quality people. And once we start attracting quality people, then what we can say is, hey, we got to put more money in the system. And this is where it's going to be important that a governor who comes in is ready to increase revenues because we're going to need more revenue to make it a reality that we can pay these people what they are worth. That's a long story to tell you that first and foremost, what's going to be important is to treat everyone with dignity. The person who needs the help, but the person providing the help. They both are entitled to dignity. The way to do that is make it clear. We value that service and we're going to pay for it what it's worth.
Thank you for that.
Yeah, I think I'm going to jump in here, Secretary Becerra, with the next question. And I just got to say how heartening it is to hear your commitment and understanding of the professional nature of the DSP workforce. It is an ongoing challenge to make sure they are recognized and compensated accordingly for the invaluable work that they do. But I am going to switch gears a little bit. It is about work, but it's not about...
Barry,
yes.
Before you switch gears, can
Sure.
I just add one last point? That's very important here. Because of my personal experience growing up, but certainly my professional experience as AG, defending disability rights, as secretary, providing additional services, can I just say, home care is where this country, this state will go. At least in my leadership, that's where we're going to go. Because you get much better care at home when you can. My father died in my home, and in his last years of life, he said, I don't want to be in the hospital. I don't care if it means I die sooner. I don't want to be in the hospital. I'd rather die with my family. So we did everything we could to always keep him at home. Home care is where you get loved, not just cared for. And I believe that we do it far more efficiently and less expensively when we do it with people who actually love you. And so I am going to move towards making sure that families who are willing to commit to becoming the caregivers actually get compensated the right way. Because we used to say, hey, you're a family member, you should be doing that anyhow. It's your responsibility. And then you'd say, well, I'd love to, but I got to make a living. I need to work. And so therefore you can't. And so guess what? Then you send the person off to some institutional facility. I want it to be that person says, okay, I'll commit to it. Just help me out a little bit. Help compensate me for the money I'm losing by not going to work as often. I'm willing to do that because I know at the end of the day, I save the taxpayers' money by not sending that individual to an institution. And I also make sure that the person gets loving care all the way through cradle to grave. And so I just wanted to mention that because I believe it's time, sort of to my mom's mejor prevenir que remediar, that we move towards home care versus institutional care. Not everybody can have home care. Some people will need institutional care. But to the degree that we can keep someone in their home with their loved ones, let's do it. I'm sorry.
No, thank you. And, I think your recognition on the benefit and value of home and community-based services and see the fiscal benefits and the efficiency of those services versus an institutional setting is really compelling for me as well. I was going to talk about work, but not the work of direct support professionals or family members. This is about work, the individuals with developmental disabilities themselves being ready, willing, and able to work in their communities. There are many of them in California, and we have quite stubborn unemployment rates for individuals with IDD here in California. California has declared itself an employment first state as a top priority for our population, but these employment rates have remained relatively flat. So the question for you is, how can the state, under your leadership as governor, how could the state support employment opportunities and also itself be a model employer for individuals with IDD?
And Barry, the answer there is pretty straightforward. Be the example. Don't tell someone what to do if you're not willing to do it yourself. And I urge you to look at my record as secretary at HHS, where I had one of the most diverse workforces in the federal government. In fact, probably the most diverse, including when it came to Americans with some form of disability. And I would put myself out there and say that the governor has to be the one to show that you can bring on a diverse workforce and prove it, so then others cannot say that they can't do it, because if the governor can do it and do it at the highest levels, everyone else should be able to do it. So that's first and foremost the principal responsibility of the governor, to lead by example and hire a workforce that includes every kind of Californian, including those with some form of disability. Second thing is, here's where our work to revamp and update Section 504 was so important, because we all find this to be the case, that people will say, okay, yeah, we think you can do some of the work, but we don't think you can do all of the work. So we'll limit you to these categories of jobs. That's discrimination, because it's not up to you to limit somebody to a particular category of jobs. It's the disability and the actual implementation that will show whether or not someone can fulfill the duties of a particular job. And you must be given the opportunity to get the chance to attempt to do the work. And so the update we make to Section 504 is to say, don't be paternalistic. You give everyone else a chance, just the way you give someone else a chance. You do it, with a blind view of the job and the person, and let them show through their performance whether they can do the job. That was so important, because so many people would say, yeah, we have the some of the accoutrements of all these protections for disabled Americans now, but we're treated as if we can't do the work, we can't scale that mountain, and we should be given a chance. And so now there are protections under the law, 504, to make sure that businesses, employers, government do not use their opinions to determine what someone with a disability can and cannot do. That becomes really important. And when you combine that, the law protecting people to go the limit of what their capabilities allow them, with someone who will lead by example as governor and make sure he is bringing on people from every walk of life, I think that should help open the door for a lot of our folks in the disability community, who oftentimes we're told, we want you to do well, but never quite given the chance to do as well as they know they can do.
Thank you. I'm going to quickly ask one more before we pass it back to Azucena. And this is somewhat related, or at least I can probably try to tie together the last question and this one. So the infrastructure to support individuals with IDD and their families, and this goes from funding of services to service coordination to data systems. It's outdated and decreases the progress that our service system can make to support individuals with disabilities. You mentioned it, I think, multiple times, that the state's commitment, the need for funding these state-funded services and staying committed to that is so important. So what is the best approach to modernizing this so that we make sure we don't fall behind, that we have the necessary infrastructure to ensure a robust network of services and supports to individuals with IDD?
And Barry, here's where I will profess to not being the one of the experts. This is where you all are going to be the experts. This is where it's going to be so important to have you in the room, because you'll probably be able to tell me where the system, our operational tools, are most efficient, because you've experienced it. Your members, your families have experienced it. And this is where I'm going to need you all to guide us, to tell us where best to go. But here's what I can tell you. Data is critical. We must be able to collect data, because when you make decisions based on anecdotal information, you can go wrong, and you can challenge and question the approach or the policy. But if you have data, at least data gives you a neutral, hopefully unbiased view. Actually, you have to be careful with the data, that you know the source of it, but it can give you something that is more neutral to guide you. And I believe that we don't do a good enough job collecting data. For example, for the longest time, we didn't collect data on from communities, ethnic communities, or communities that didn't speak English very well. And so everything was informed based on communities that were English speaking. Well, that would have left out my family. And so we need to make sure we collect robust data to help inform where we go. So when you're sitting at the table and you say to me, we need to update these systems, we need to change this policy, I can say, okay, show me the data that supports what you're telling me. Because we're going to need to have something that we can all agree that we rely on, that tethers our policy making. So regardless of our divergent views, we can all come to some agreement based on the data helping inform the best way to go. And so I can tell you. But in terms of the actual changes, how much we should, this is where you'll have to help me as well. In this scheme of things, where we know we don't have enough resources to pay some of the folks who do the work enough to have regional centers that provide more services, to have a system that's not obsolete, we're not going to have enough dollars to do everything all at once. And so this is where I will turn to the community that works this every day and say, okay, so given these dollars, how best to use them? And you will then guide me. Because so when someone in the community says, you didn't put enough into updating these systems, I can say, look, I relied on the guidance of the community that services the disability community to help inform me. And this is why we didn't put as much money in the updating, because we wanted to increase salaries or whatever it might be. But this is where it's so important to have a room where you have people with lived experience who are helping guide the roadmap that we will have for the governor, because you will be able to help us make those tough choices.
Really appreciate that. And I assure you, we have some ideas.
Which is, I know.
We'll be happy to partner.
Amen. I know. I have no doubt. And I know I'm going to have to add some zeros to those budget numbers.
Well, all for the greater good, as we all believe.
Yes.
Okay. Thank you so much for the answer, Azucena. I think you've got the next one before we maybe go to some Q&A from the audience.
Yeah, and I just want to mention, I very much appreciate that you, in multiple occasions, have mentioned that you would have people with lived experience at the table, right? Because we are sort of, I studied political science, but my expertise does not come from my degree in political science. My expertise comes from living in the systems. And one thing I learned and I know is that policy is only as strong as the people that stand behind it. So if you have people who live through struggles day to day, it will stand. My next and last question before we have to an open Q&A, if you were to become governor of California, what would your approach and commitment be to our K through 12 students that are currently in special education?
First and foremost, to defend their rights, because they are entitled to an education. That we call it a special education doesn't change the fact that they are entitled to that education. I say that having served as the Attorney General. You can look back if you Google the Stockton Unified School District, you will find that while I was Attorney General, I took an action against the Stockton Unified School District because they were using the police to do a lot of their work for children who were challenged. Oftentimes we found it was minority kids. I believe there were some kids with some special needs, again, where they found that these kids were challenging disciplinary problems. And the actions that the Stockton Unified School District would take were to call the police. They would treat this as a strictly disciplinary law enforcement problem rather than trying to address the challenges those children were facing. We took an action. We told them, we're going to file a claim against you for discrimination unless you change your practices. And fortunately, they were willing, after we showed them all the evidence we had, to sit with us, and we worked with them to actually change the way they handle individual children who present challenges to the educational institutions, and that they had to do much more to provide the counseling and the services, support services, rather than turn it immediately to the police as a disciplinary issue. That to me is what informs my approach as governor. Is I will defend rights, education rights, period. Special education means you get the rights to get educated. You may need them slightly differently, but you're still entitled to those rights, and I would do everything to protect them. That means you're going to sit with me and talk to me about budgets, because it costs more to provide special education than it does just regular K through 12. But that's where we show, again, through our budgets, where our values reside, and I'm prepared to do that. You mentioned, Azucena, how lived experience should inform so much of what our policymakers do. Too many have not lived the situation that a family with someone with a developmental or intellectual disability has. And it makes it then tough for them to totally understand it. But when you've gone through life, as I have, being the first secretary of HHS to be Latino, to be the first attorney general of California to be Latino, to be the first Latino in Congress to serve on the Ways and Means Committee, you're the first a lot of times, which means no one before you could present the same lived experience you could sitting on that Ways and Means Committee in Congress, or serving as the Attorney General for California, or serving as a Secretary of Health and Human Services. There were a lot of things I did that came from my being someone who lived these things. So Section 504, when we updated it, defending against discrimination under Section 1557 of the Affordable Care Act, establishing the Disability Rights Bureau as the AG. All those things weren't just, they pop up in your mind. No, it's from having lived these things that say, why don't we do this? Hey, actually, I can do it because I'm the AG, or I can do it. I'm the secretary. No longer do I have to wish it could happen. I get to do it. I always tell young people who ask me, what does it take to be a strong policymaker? I always tell them, if you want to know where a leader is going to take you, know where they've come from. And so I know where I've come from. And I think through my actions and practices, I think you can see where I would take the state of California. I think it's so very important that we know where a leader will take us. And that's where lived experience really informs where that leader will.
Susanna, just wanted to say thank you. I know that Jordan's going to pop back on and bring in some questions that we've received in Q&A from the folks who are watching today. But on behalf of the Lanterman Coalition, I just want to thank you, Secretary Becerra, for a wonderful conversation, really thoughtful and detailed answers. And it's been an absolute pleasure to have this conversation with you today.
Thank you. Appreciate it.
Yes, Secretary Becerra, there has been a lot of questions for you. A lot of them you covered, which is wonderful. A lot of things, questions around special education, which that last question and answer just addressed a lot of those questions. So thanks for your thorough answer on your approach to special education, enforcing IDEA and other rights there. There's been kind of a theme around oversight. And of course, in your roles as Attorney General and Secretary of Health and Human Services, you not only are upholding programs, but there's a lot of oversight and enforcement and accountability there as well. Can you discuss maybe your approach to accountability and oversight to make sure that dollars spent are going from the government are going to the individuals needing it, and what your approach as governor might be on oversight and accountability of the various human services programs that impact people with disabilities?
Absolutely, Jordan. Everywhere I've gone, Congress, AG, HHS, it's always been the case that if you do oversight and you take action early to enforce, you actually save taxpayers a lot of money, more than it costs to do the oversight. The difficulty is you don't see the savings until later on. You see the spending up front in doing the oversight. People, too many times Americans aren't patient, and they don't, they want to see the results right away. But what I would do is I would say to folks, look, if we do this oversight, if we make sure that your child is receiving special ed when you need it, because we had people who were actually doing the inspections of the school, coming and visiting and talking to the families and finding out if the services were sufficient or not. It may cost up front some money to make sure your child gets the special ed services that they're entitled to under IDEA. But the long-term savings are going to be real, because that child will learn more faster. And I'm less likely to face, as governor, a lawsuit from your family because I didn't provide your child with the services they were entitled to. And you'll beat me in court because you'll be able to prove that I didn't. And so overall, the cost is far less. It's the pay me now, pay me later, the penny wise, pound foolish. It's my mom. Prevenir, no remediar. Prevent, don't remediate. I will, and again, you have the former Attorney General telling you this. I'm going to do oversight because I know I save money, a ton of money, when I find the bad apples early instead of letting the bad apples dictate how the good apples have to operate.
Thank you very much for that answer. And you, of course, bring a lot of experience in that category. Another theme I would pull out of some of the questions is HR 1 and the federal government. The state, of course, right now is going and is currently feeling the impacts, and soon will feel even more impacts of HR 1, the One Big Beautiful Bill that imposes lots of cuts to Medicaid-funded services and individuals that rely on Medicaid in California, of course, Medi-Cal. How would you protect against the effects and impacts of HR 1, and what would your approach be with the federal government?
Jordan, I've said it publicly since I launched this campaign for governor that under my watch as governor, California will not go backwards when it comes to healthcare. We cannot afford to. And I've already explained it. Prevenir, remediar, penny wise, pound foolish. It makes no sense to deprive people of the services they need, because ultimately you're going to get them. And by the time you get them, especially if you've had to wait because you couldn't pay for them yourself and you were hoping you'd get better or your child would get better, but things didn't improve and you waited and waited. Now things have been exacerbated. Now when you finally go in to get care, it's going to cost more. And it's going to cost way more because chances are you're walking into the emergency room to get care, that health care. Or you're now filing that lawsuit because your child didn't get the support services to get through uh, the educational programs at the schools. And so it is far better to do it early than later. And what I intend to do when it comes to healthcare and HR 1 and its cuts is essentially say, we're going to figure out where we need to backfill, but we won't go backwards. And I will tell you specifically when it comes to healthcare, and I think everybody on this Zoom knows, we spend more money for healthcare in California than does any other state. We spend more money for healthcare in this country than any other country in the world. There's money. It's just that it's being siphoned off. And so it's not going to actually provide to dispense care. And what I'm going to do, because I've been in the bowels of these systems as HHS secretary, as AG, and we're going to extract some of that waste, the middlemen who take a ton of money out of the system and never offer anything. And I'll give you one real quick example. Now, forgive me if I don't explain it all. I hope you understand. Insurers try to make sure that when they get a bill from a provider, they can bring it down in terms of the actual invoice charged and say, oh, you're charging for a service that is not the service that you actually provided, or you're billing for a service that really is too high. It's called that they say that the provider is upcoding. They're coding for a service that wasn't the essential service. So they try to down code and at a lower reimbursement rate. On the other side, the providers, they know the game the insurers play. So they always try to file for an invoice with the highest coding they can get so they get the highest level of reimbursement. The game that is played, the money that is spent hiring people, accountants, lawyers, computer whizzes to try to figure out how to game the system on upcoding and on downcoding is in the billions. Nobody gets care as a result of that. Just a lot of people get rich by trying to figure out how to game the system. Let's get rid of that. Let's make it so that there's no upcoding or downcoding. Save a lot of money. Actually use it to provide care. That's how you can save some money. But no doubt, that's where I said before, we're going to need revenue, and we'll make sure we get revenue because we're not going to let the man-made disasters coming out of Washington, D.C. determine how we do care and services for our California population.
Fantastic. Thank you. And you've been generous with your time. Do you have time for one more? Or do you need to go? I know that you may have.
I'll do one more because I probably went longer in some of my answers than I should.
No. Okay. I think perhaps the last question would be, let's get into this is a labor PAGA. So this one is a little out of left field, but it's not actually. It's not actually because it impacts a lot of. There's a lot of PAGA lawsuits for those who are joining with us. It's for employment liabilities for employers. The employers happen to be disability service providers. Lots of attorneys are getting money with PAGA lawsuits. And the question was asked, would you be open and willing to look at reforms in PAGA? There have been a couple reforms in the last few years. But this area does impact the developmental disability community. So thought I'd throw that one out at you.
Yeah, and that one, Jordan, is actually really important because PAGA was passed to allow there to be private attorneys. Was passed because if certain communities relied only on the government attorneys, the Attorney General's office or district attorneys or city attorneys to defend their rights, they might be waiting a heck of a long time and maybe never get justice. And so allowing private individuals to sue themselves was to help them get to justice quicker. And so there was an underlying premise to PAGA. Now, as I just mentioned about all those third parties that extract money out of healthcare without doing anything to provide services, you're going to have those attorneys who are out there just to make money for themselves. And they'll sue somebody, and essentially they're waiting for the settlement to occur. They're never really planning to go to court. They're just going to sue and get something out of it and move on to the next case. Yeah. And file case after case after case. They're not even so much concerned about the plaintiffs, the individuals who are saying, hey, I got denied my rights. They're just trying to get, their 30 to 40% cut of the settlement. So here's what I will tell you. We have to have it so that whether it's PAGA, whether it's upcoding, downcoding in the health system, we're taking the bad apples out of the system because they ruin it for the good apples. There are some individuals who have disabilities who are facing situations where their rights are being violated by an employer, a business, and so forth. And they should have every right. They're entitled to make sure that their rights are enforced and protected. At the same time, we don't need to drive businesses out of business, employers into not having enough to pay all their workers because they're having to settle all these lawsuits that are frivolous. I'm willing to look at reform. I say this as an attorney. I say this as the attorney general who worked with a lot of the attorneys who deal with a lot of these consumer violation cases. And we need to protect people's rights because consumers are absolutely injured and hurt and die. At the same time, we all know the story of the case of some mom and pop that got sued and had to close their business because they just couldn't withstand the frivolous lawsuits. So absolutely willing to look at it. And I look at it from the perspective of someone who's had to deal with these as an attorney.
Well, you have been very generous with your time, and what a great conversation. So thank you, Secretary Becerra, for taking the time to join us today. And of course, this video is going to be shared widely across all of our networks in the coalition, and look forward to continuing the conversation in the weeks and months ahead with you and your campaign. So thank you again for joining us, Secretary Becerra, and having a conversation with California's developmental disability community.
Oh, thank you. As I said at the beginning, this was personal for me, and I thank you for letting me participate.
Great. Well, we're going to let you jump off to, I know you're a busy man, have things to do. Thank you so much.
Thank you.